Okay, let's get started. Been having minor technical problems, which we have occasionally from time to time. It's my pleasure to welcome you to the University of Tennessee Nuclear Engineering Department Seminar Program. We have a special speaker today, and we have a special person who's going to introduce the speaker. But before I turn the podium over to the person who's going to introduce the speaker, I need to make a few comments. Some of you who have seen the advertisement for today's seminar, you may be wondering, what is the connection between nuclear engineering and learning about the health of a country in West Africa? Well, there is a connection, and the connection is food irradiation. As many of you know, we have been in this department involved in food irradiation for a few years. We've had several student design projects in the area of food irradiation, and there's a reason for that. Food irradiation has the potential of saving thousands of lives, particularly in third world countries like Ghana. And the way it does that, of course, is by extending the shelf life of food. In third world countries where there is little or no refrigeration, little or no electricity, and therefore little or no refrigeration, food spoils rather quickly. And in fact, 75% of the food in third world countries will spoil before it can be eaten. It just can't get to the hungry people in time before it spoils. So if we can extend the shelf life just a week or two, which you can do with food irradiation, so that the food can get to the people, you can literally save thousands of lives. And that's what's exciting about this. I mentioned this in a presentation in which one of my colleagues, Dr. Deji Badru, who's the head of the Industrial Engineering Department at UT, he was in the audience, and he heard my comments, and he came up afterwards and suggested that, first of all, he pointed out that he has connections in Ghana. He's from Nigeria himself, and that he would like to team with us on a research proposal to try to export this technology to Ghana, to implement the technology in Ghana. And this really excited me, and so we plan to do this. We're not sure exactly how we're going to do it, but we certainly want to do this. And so it occurred to me when I found out that our speaker today had been to Ghana, that it would be good if we learned what the culture is in Ghana, what the community's like, or what the health problems are. And so I invited the speaker to come and speak to us today. And so with that background, I'm going to ask our own Dr. Peter Groer to introduce today's speaker. Peter?
Well, thank you, Lee. I hope you're all warm here. I'm kind of nervous doing that. How many people get to introduce their wives for the seminar? And that's a first for me. So let me just give you a brief, professional history of what Maureen has done in her professional life. I met her, I think it was in 1967. I hope I don't mess up. And she was close to graduation from a small college in the Boston area, Newton College of the Sacred Heart. This college, unfortunately, disappeared, and now she is officially an alumnus of Boston College because Boston College took over. Then she got interested, I'm not quite sure what triggered her interest, she got interested in radiation biology. And so she enrolled at Boston University and got a master's in radiation biology. So she's not as innocent about radiation as you might expect. She knows a lot about radiation. I still remember the project. It had to do with reactivation of a form of the herpes virus in rabbits. And the unfortunate thing was every weekend before we went skiing, we had to see the rabbits. And what you had to do is, I never did it, you had to take a cotton swab, go in the eye of the rabbit, and then I don't know what happened to that. So we had to do this every day, every time before we went skiing to Maine or so. So that was her effort in radiation biology. And then we moved to Illinois, and while I was at Argonne, she enrolled at the University of Illinois, the Chicago campus, and got a PhD in human physiology. I have to say I'm kind of in the dark what this research was about. It had to do with red blood cells, but that's about the end of my knowledge about that. And after that, we came to Knoxville, and she joined the University of Tennessee and has stayed with the university with an interruption of about, I think, 4 years? 5 years, where she was a president of a graduate school in the Boston area. So she has several degrees. I didn't mention all of them. I guess one of them is missing. That's the Master's in Nursing. Maureen's research interests at the moment are in, I hope I can pronounce this, psychoneuroimmunology. If you don't know what that is, well, ask after the seminar. She has now a laboratory over in the College of Nursing where she conducts her research. And in addition to that, she also taught a course, and this course turned out to be kind of an interesting course because it was not taught at UT, it was taught in Ghana. And that's my bridge. With great pleasure, I'm introducing my wife and our speaker, Maureen Groer.
Thank you. Well, thank you very much. It's a pleasure to come here today and tell you about this experience. I'll give you a little background about how I got into it, because it was totally unplanned and unexpected for me to do this. I was very busy with writing and doing research and teaching, and I met a colleague at a conference. And she began to tell me how the University of Massachusetts had set up a clinic to train nurse practitioner students in Ghana, and what a great opportunity it was, and the students learned a great deal in a very short period of time, and it was very rewarding, and I thought, oh, that's wonderful that you're doing that, but I could never do that. And so I went home from the conference and tried to forget it, but I couldn't forget it. It was something, a weight on my heart. I kept thinking about it. I should do this. I don't know why I thought that, but it just kept bothering me. And then I thought, well, surely there won't be any students at UT who'd want to do this with me, and so that will get me out of doing it. If nobody wants to go with me, there's no reason really for me to go alone. So I put a small notice up in the College of Nursing and asked for people to come to a meeting and fill out a little form if they might be interested in doing a service learning project in Ghana. And I had about 20 spots, and 40 students applied and were seriously committed, and I had to actually do a lottery to pick the students to go. And we had students that were both graduate and undergraduate students, and of course with that kind of commitment on the part of the students, I clearly had a mission to go on this trip. And this is our group leaving Knoxville for a very long trip on Ghana Air to Accra, which is the capital of Ghana. And you can see that the students and the faculty, and I'll just point them out to you.
Let me see.
It worked before.
Yeah, I know.
It's okay.
Push the little button. Push the little bitty button between the two buttons. On the top. Yeah. Okay.
Okay. Well, these are graduate students and undergraduate students and 3 faculty that went to Ghana. I'll need that, maybe. And we're leaving in August to go to a little community called Sekondi Takoradi, which is in the northern part of Ghana on the coastline. Ghana is a country that's about the size of Illinois, and it is right really at the equator. It's very warm there, and it has a population of about 19 million, and it is an interesting place because the people there, 90% of the people are extremely poor. And the healthcare system in Ghana is such that immunizations are provided to children so that they can get immunized against diseases, but any other health care is a cash upfront basis. And just to see a doctor, a person needs $7. Now, we think $7, no big deal. I'll tell you a little anecdote to make you appreciate what $7 is to the people in Ghana. The first day we were there in Ghana, I went jogging. And it was like 5:30 in the morning. I was with a bunch of students, and they were all going to go jogging. So I said, oh, yeah, I'm going to jog with you. Well, of course, they were gone as quickly as we went outside, because they're all about 25 years old, and I'm a little older than that. So I was dragging behind and jogging for a long time, and I ran out of water, and I was kind of dripping wet, and I'm standing on a street corner, and all of a sudden I realized I am lost, I am thirsty, I am alone, I have no money, and I am in Africa, and I have no clue what to do next. And it was a really scary feeling. So a little boy was standing on the corner, and most of the people in Ghana speak English, especially the younger children. In fact, English is the language of Ghana. So I said to the little boy, can you bring me to this mission? Do you speak English? He said, yes. Can you bring me to this mission? He didn't know what mission I meant. Finally, I remembered there was a naval station across the street with a great big fish. So I said, can you bring me to the fish? He said, oh, yeah, the fish. So we went in a convoluted pathway back to the mission, and I went in, and I said, please wait here. I want to give you some money for helping me. I really appreciate your help. Well, I had a $20 bill. That's the only money I had that wasn't broken down. That was the lowest denominator I had. So I went out, and I gave Andrews, this little boy, this $20 bill, and his eyes got huge. And he went home, gave it to his mother. That money fed his family for over a month. $20 is a huge amount of money to these people. So it's a very poor country with, in fact, an annual household income of less than $400 a year. So you can imagine what that must be like. The minimum wage is 80 cents a day. So people are working there for 80 cents a day and trying to feed their families. There's also a life expectancy that's kind of shocking. The life expectancy is 56 years. And when I was there, people would always ask me, how old are you? How old are you? Well, I'm 56 years old. Oh, how come you're so strong? They kept them being amazed at my, quote, strength. That's how they described it. I was so strong. Because at 56, we saw many patients who were literally aged far beyond 56. They acted and physiologically looked like they were 80 years old. So it was really a different sort of experience in terms of that. Most of the income that people make is made on their food, pays for their food. And getting medical care is pretty much an impossibility for most people. And so unfortunately, this place that we go to in Ghana, Sekondi Kakarati, the only medical care that is given is what we provide different schools of nursing, Clemson, UMass, now UT, and San Francisco State, faculty and students each year. And we have some medical students from New York, from medical school in New York, and a couple of residents going with us occasionally. And that's it. That's all they get. So, as we head out, we had a long flight, arrived in Accra, and then took a bus that was quite memorable, with 20 of us in this bus. And it finally arrived at Sekondi Kakarati. And you can see it's on the ocean in the back. And these are all people's homes. A couple things I'd like you to note about their homes. There's not 4 walls. Many of the homes have 2 or 3 walls and an open area. And in front of every home is a fire. And that's where the cooking is done, on a charcoal or wood fire. And along the street, I don't think you can see it well, there's a latrine. And this latrine runs into the ocean. There is no sewage system. There is no sewage disposal system. There is no electricity. There is no running water. Oh, thanks a lot.
Laser point.
Yes. So this along all the streets are these latrines, and in front of every house is a wood fire. It's very smoky. The environment is very smoky. Almost everybody I saw had some degree of conjunctivitis, eye inflammation from the smoke. It's also smelly because this is open sewage just going into the ocean. And because this beautiful beach here looks so inviting, we thought maybe we'd go swimming. There would be no swimming in that water because it would be heavily contaminated. And just a little bit far out on that ocean are all the fishermen, because this is a fishing village, and most of the men fish there. The women weave the nets. On Tuesdays, everybody weaves nets. No fishing on Tuesday. They all go out the rest of the week. The one thing about the food there that I found amazing was the cheapest food, the most accessible food, was lobster. So we ate lots of lobster. However, a chicken would be a whole different story. And in fact, the staple of the people is goat. And we ate, I didn't, but we had goat served to us in many different forms on the trip. This is the complex that we were at. It's a mission complex. We're not in any way connected to a church, but this church has opened up their complex, their dormitory rooms, their hall, so that we can serve the people there. So we stayed in the International Missions Complex, and in fact, this is Andrews, the little boy who rescued me, and Andrews kind of hung around the mission from that point onward. We're correspondents now. He's my buddy. Now, I know you're interested in the food, so I did try to focus these slides somewhat on the food. Let me tell you a little bit about their food staples and so forth, because we saw a lot of malnutrition. Most of the people have very little protein in the diet. If they do get protein, it's mostly fish or goat. And you don't get meat every day. In fact, when we did diet histories, most people don't get meat but once or twice a week, and often it's fish, not meat. And like chicken, which are free-range chicken, once a year is the average for a Ghanaian family. And we felt very badly because we were served chicken one night, and none of us could eat it because none of us had had that taste for free-range chicken. And we took a bite and we didn't eat it. And the people in the kitchen were most shocked that we would send back to the kitchen this food where people in Ghana never get to eat food like that. But you can see in the market, people are running around all the time with their wares for sale, and most of the women do all of the household work, all of the cooking, all of the food preparation, all of the marketing and selling of the food, as well as the children. The children are everywhere, and they get involved in this enterprise very early in their lives. The women carry enormous loads on their heads. You cannot believe what they have on their heads. And some of them have special little hats that hold these loads, but some don't. In fact, I saw a patient in the clinic, and she had some cervical disc problems, and I discovered that she was walking around Ghana with a sewing machine on her head. She was a seamstress, and she needed a sewing machine, and so she carried it with her on her head, a sewing machine. And I said, well, why don't you carry it some other way? She says, well, I couldn't lift it with my arms, but I could put it on my head. That's the burden that they learned from very early on. They learned to carry these enormous burdens. In the market, too, what you'll see here is food just laying out, not covered with saran wrap, not preserved, made presumably that day, picked presumably that day. And one of the staples of the marketplace, you can barely see it, is this material. And it's made from a root, and it's mixed in with a very common substance there in Ghana called palm oil. And palm oil is their major fat source. Palm oil is very red, the kind that they use in cooking. It is so red that it makes people's hands red. Their skin turns red from the amount of palm oil they have in their food. And that is an oil that doesn't spoil easily, so they use it in many, many dishes. They pound this root into a cake, and then it's a cassava root, and then they wrap it and you can see people selling it on the side of the road. And that is a big staple in the diet, this kind of food. But you can see the conditions, the utensils, the equipment. This is in the market, but you could also see this in front of somebody's house. She would be sitting in front of the house preparing this food. And here's some more traditional foods, fruits and vegetables. One of the fruits that is delightful and very fresh is pineapple. So we ate a lot of pineapple. And there are fresh vegetables available, lots of palm trees in the area, and you can see peppers and things of that nature. One of the things we discovered about the food is that it's very highly seasoned. And the reason for that is so that it won't spoil as quickly. The seasoning is, in some sense, a preservative, or it covers up the taste of any kind of decomposition that might be going on in the food. Our students were not used to the Ghanaian diet. So we tried very hard to adjust, and mostly we got by okay. We all took medication in case people got some gastroenteritis, and some of the students did get diarrhea, so they had some problems with the food. One of the students lost 15 pounds, one of my young men, in just 2 weeks. All of us lost 7 to 9 pounds just in those 2 weeks. Now, it's the Ghanaian diet if you want to go those ways. Basically, because the food is so different. You know, you can only eat so much lobster, right? You even get sick of lobster and shrimp, believe it or not. But we're a little concerned about the fishing boats being fairly close to the shore where they were fishing. Here's a young Ghanaian girl, and she's got peppers here, hot peppers, and they'll grind those up and put them in their foods, like stews, a lot of stews that they make with goat. In fact, when we came to Ghana, we saw on our trip from Accra to Sekondi all these little goats everywhere, and we said, oh, aren't they cute? Everybody's got pet goats, you know? And they all seem to go to their houses, and they know where their homes are, which is true. They wander around the village and then at night go back to their home. But they go home, and they're eaten. And very few of them are actually milked. I thought we'd have a lot of goat cheese and milk, but they don't get enough diet themselves to produce milk. So they're only used for meat, very little for cheese and milk. They don't mature far enough to do that. Now this is the city, and actually it is a true city, Takoradi. This is Dr. Pat Doppelman and her translator. Each of us had a translator there, students and faculty. The language in the tribe in that area is Fanti. And so the older people would speak Fanti, and the younger people would translate for us into English and back and forth like that. But these are all businesses, and the kinds of things that they sell, for example, fabrics, beautiful fabrics, some hand-dyed and hand-weaved fabrics. We all bought fabrics, and then seamstresses would make clothes for us to bring back and to wear there. Shoes. In Ghana, many of the people don't have shoes. And that's a big problem because many of the diseases that they get are due to infections coming through their feet. So there are shoe stores there, and the collection of shoes that you would see there is just really, it's unbelievable. You know, there's women's high heels like this, and then there's mucklucks and flip-flops and all different kinds of shoes that people could buy, because shoes are a precious commodity. When I asked the children there, the little boys that I got friendly with who used to jog with me in the morning after that first day, I never went out alone, they helped me. I asked them what they would like from America, and they said 3 things. They would like $20, because that would buy their school books, their paper, their pens, and it would also buy shoes. And I'm not talking about, Nike Airs, I'm talking about flip-flops. Just some shoes. They're not allowed to go to school if they don't have shoes. And this is the one thing that was holding some of these very bright little kids back from school were the shoes. So $20, that. And then the other thing that they wanted was soccer balls. They love soccer. And they use anything they can to make a soccer ball. So the UT women's soccer team donated 20 used soccer balls, and we sent those over in November, I think it was, to the kids in Ghana. And I'm sure there's a lot of happy kids running around playing soccer. Yeah. The city has, there is electricity in these shops. There is plumbing. We had electricity and plumbing, so there are places where electricity can be delivered. But the majority of people, 99% of the people, don't have access to those sorts of things. Here's more pictures from the city. Here's a lady with these cassava roots on her head. And I can't tell exactly what she's got on her head, but you see this everywhere, even young girls. And we do see a lot of compression of the vertebrae because of the loads on their heads. One of the things that struck me about Ghana, being a woman, the girls and the women, they don't go to school. Almost none of the girls go to school. The boys go to school. The girls, from the moment they're born, learn to be housewives, to keep a home, to cook, to do those sorts of things. Very few of the girls that I met went to school or wanted to go to school, considered going to school. So it's a very divided gender culture in Ghana right now. Things are changing, but it's going to take a while. It's a typical home by the sea. People don't have beds. They lie on the ground. When they get tired, they lie on the ground. And sometimes they lie just wherever they're at and go to sleep there. And we were in our cots in our little compound, and none of the beds had sheets. They had under sheets, but nothing on top, because nobody puts anything on top. It's too hot. But we were all lying there looking at each other, with nothing over us. We can't sleep like this, even if it is hot. We have to have something over, so we're putting things together, towels and coats, anything we could, just have something over our bodies while we slept at night. But they just sleep right on the ground. They don't even have a mat. They just sleep anywhere. It amazed me that they would do that. Okay, these are a bunch of children, Ghanaian children. Every time we go, we have a party for the children and invite a whole crowd of kids. And notice how nicely they're dressed. Now, these are people who have no electricity, no running water, no sewage system, and yet all these children are very clean, and typically Ghanaians bathe twice a day. So they're very clean. They want to take care of their clothes. They're very proud of their clothes. They have beautiful clothes, the women particularly. And their children were just very well kept. And these little kids, this little one here, she had the peanut butter and jelly sandwich. It's the first time they've ever seen a peanut butter and jelly sandwich. They didn't know what to do with it, And the older kids, they've been around the block. They knew they could. Right arm. Huge, terrible blisters. A whole pot of soup had fallen on it. And the baby surely would have died of infection if it hadn't been treated and it had been turned away. So I went and grabbed that baby and put the baby on antibiotics and debrided the burn and wrapped the burn and saw the baby every day. And of all the patients that I saw, this is the one I remember the most because the burn was healing when I left. I mean, if you could imagine a burn where this little baby's brown skin was just coming off in sheets as I debrided it. And there was not, he would never have survived, I'm sure. But he's okay. And he even stopped crying when he saw me on the last day because he knew when he saw me he was going to hurt because debriding and treating a burn hurts a lot. So this is the triage area where we see who really needs to be seen and what their vital signs. These are some of the students. We had several days of rest and recreation, and we needed it on this trip. This is the Minister of Health for the region, so Dr. Ibrahim, and it might be really useful to get some contacts made for you folks when I go back there because he's very supportive of the mission and of our purpose there. And this is Dr. Lita McHenry of Massachusetts, the University of Massachusetts, who started the clinic. She's been doing it since 1996, and we figure we've seen 20,000 people in that time in this community. So that's quite a lot of people to see. We've also set up a hypertension clinic. It's tough when you go there because you can't really treat the chronic diseases because who's going to be there to follow up? If a person had a chronic disease that needed medication, that needed constant surveillance, what are you going to do when you leave? There's no one there. But with hypertension, we are able to treat the patients, put them on medication, and we trained community health workers to monitor blood pressure. We taught them how to take blood pressure and how to monitor medication. And so we have a hypertension clinic in the church that's ongoing all year round, even when we're not there. And Dr. Abraham really is very happy that we're doing all of this for the people there. There's myself and Dr. Pat Droppelman. These are the clothes that were made individually for us from fabric that we bought there. They basically came to our compound and measured us and asked us what styles we wanted, and within 2 days brought back beautiful handmade clothes for all the students. We all bought lots of things, and they were delighted because this was their source of income, tourists who might come to this area. It's not an area that's heavily touristed either, so. But we felt badly because we knew that they were up night and day. They didn't sleep while we were there making all these things. But this is what they wanted to do. This is their way to make money. This is the waiting room in the clinic where you can see, people. This lady I remember particularly because her blood pressure was 240/180. That's pretty high. Very high incidence of hypertension. You'll read in the textbooks, including a textbook I wrote, that Africa has a very low incidence of hypertension. It's only African Americans that have developed hypertension. And that's not true. Ghanaians have a very high incidence of hypertension, and we saw like that. You see families, babies, lots of babies that are needing to be seen. Some of these babies have fevers of 104. They've been out in the rain all night waiting to get in to see us. This is our office. So we had planks that we set up between church pews and put down a pad, and then we had no running water to wash our hands. So in between patients, we couldn't wash our hands, so we had to use the wet, dry sanitizer on your hands, and be real careful, use lots of gloves and masks and so forth. We had the basics. But I was very fortunate in being able to get 14 duffel bags full of donated medicines and medical supplies from local physicians, nurses, and companies here in Knoxville. And I just found out for our trip in March that a Lions Club in Virginia has donated 1,200 pairs of prescription glasses. These people, obviously, if they don't have health care, they don't have glasses. And you can imagine what your life would be like if you didn't have glasses. We had one young man. He was a student. He was doing well, but he was to the point of not being able to see anything. He couldn't read. He couldn't study. Couldn't read. And Dr. Pat Droppelman gave him the money to go and get glasses. And he came back the next day. You never saw a bigger smile on a person with his new glasses and the fact that for the first time in many, many years he could read, he could study, he could go on with school, all because of, I think it would cost him $12 for a pair of glasses for this young man. So we're bringing these prescription glasses. We also have a drive in many of the churches in the area to collect sunglasses because in Ghana the sun is intense and most of the people over the age of 40 have cataracts, and the cataracts are due to the sun. And so they would wear sunglasses if they could afford them, but they can't afford them. So we're bringing many, many, many hundreds of pairs of sunglasses with us this time, along with the eyeglasses. So we're going to be busy doing optometry while we're there too. This is how we would examine the patient. There's a student, myself, and this patient. She had a thyroid like this. It was a huge thyroid gland. There's quite a lot of hypothyroidism there. And in back, this is the pharmacy where we're getting our medicines aliquoted out for the patients that need them after we're prescribing the medication. We didn't bring many clothes, and what we brought, pretty much we left everything there. So we were parsimonious with what we brought, and mostly we wore scrubs or T-shirts and jeans and things like that. And they would come every day and clean our compound, and they would scrub it clean They would look for any mosquitoes because we were all on, afraid of malaria, and we were all, of course, on anti-malaria. And then they would take rocks and some soap, soap like you've never seen, but a kind of soap, and wash our clothes. And then they'd hang them up to dry. So every day all the patients would come and walk by all our underwear here and our UT T-shirts. We all had Ghana Health Mission UT College of Nursing T-shirts here. And that's kind of funny. That's kind of weird. This is, Peter didn't tell you, my area is psychoneuroimmunology, but I'm doing research on lactation physiology and immunology, and this is amazing. It is a law to breastfeed in Ghana. It is against the law not to. Now, of course, if you didn't, what would you do? Your baby would die because there is no formula on the shelves in the market. There's no other choice. So all the problems that women have here breastfeeding just don't exist there because you have to breastfeed. And it says 6 months, but most of the women breastfeed for much, much longer than that. And actually the babies in general, except for a few really malnourished babies that were in peculiar situations, the babies were fat and healthy. It's only when they leave the breast and start eating the traditional high carbohydrate, low protein diet that you see signs of malnutrition. And almost all of them don't get enough vitamins. We gave out thousands of vitamins. This is Alex Amise, and he's my translator. And I say, thank heavens for Alex, because he certainly helped me out. But what was funny is I would ask the question like, have you been having pain in your belly? And he would translate it. Have you been having pain in your belly? Into Santi. And then the person would answer. And it would go on for about 3 minutes, her answer, blah, 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 blah. And I'd be sitting there. And then he'd finally finish with the answer and turn to me and says, she says yes. This happened over and over and over again. So I don't know what they were talking about. But he'd always say, says yes. Or says no, but that was his answer. Alex, by the way, I'm hoping to bring to UT to study to be a nurse practitioner. He has a bachelor's degree. He is a teacher there, but he got so interested in healthcare that he decided to perhaps come to UT and become a nurse practitioner. This little baby had an attack of malaria the day before, you see. Here's the mama, and this is how they carry all their little babies. They're really attached to them all day long. And in fact, these babies wrap their legs around their mother's waist, and when you unwrap them, their legs are out like this. They're just so used to being in that position all the time that you have to get them to move their legs around to get a good exam. But this baby had like 106 fever, and it was axillary. It's the highest fever I've ever measured, axillary, under the arm. Very, very high fever. And in fact, it was so high that we immediately put the baby in water, tepid water, and sponged him off and gave him drugs to bring the fever down. But the next day he was normal. He was afebrile, which is what malaria does. Almost everybody there has malaria, and almost everybody needs treatment for malaria and for worms. Everybody's dewormed every 3 months. They get good care, or if they just do it on their own, they can buy these drugs in the drugstore. They have the money, and they need treatment for malaria. There's some degree of chloroquine resistance, too, so you have to worry about the drugs. At the end of our visit, all of us are gathered here together in our traditional gowns that the community made for us. They actually made these gowns for us and put them on our beds the morning of the visit. And they had a wonderful ceremony and service, and the whole community came and sang to us, and we danced with them. We had a wonderful time. And they presented us all with certificates that showed their appreciation. And then finally, there's skinny guy now. Finally, we returned home. A group of people very enlightened, very thankful, very overwhelmed. And in terms of the concept of service learning, I think what we saw in that environment was that when you're teaching and learning a concept, an area, you can do it in a lot of different ways. But in a service profession like in nursing, doing it by actually participating with people who desperately need the care and who are so thankful for this care, just really engraves that learning on your heart and on your brain. And all of our students said that this was an experience that they would never have passed by. You know, it was a very deep and even spiritual experience. It was spiritual in the sense that everybody in Ghana goes to bed when the lights go down, when the moon comes up and the sun goes down, and wakes up when the sun comes up. So that's 5:30 in the morning every day, and every morning at 5:30 in the morning we would hear the church choir singing "Good Morning, Jesus." It's just awesome to have this sense of spirituality. The people in this area are very spiritual. They're very friendly. I don't know if you agree, but most people say that Ghanaians are the most friendly people in Africa. They are very grateful for what we've done, and they're very intelligent, and they're also very industrious. These little boys, you know, they want to go to school. They'd give anything to go to school. They see that as their hope. So what's happening now is that this health mission is branching out. In fact, the University of Massachusetts is bringing some computer folks next time and some mechanical engineers. And this community can be a focus of service learning, I think, for all different kinds of people, all different groups of students and faculty. And the community benefits, and we benefit from this activity. So, I'd be happy to answer any questions that you have.
Any questions or comments, Ron?
You may have said, what was the population?
Of secondary Takarati, I don't know the exact number, except it is the most densely populated area. And so it has the highest incidence of certain illnesses, like AIDS. It's the second highest in West Africa. The illnesses that we saw are from people being densely populated and communicable illnesses, as well as illnesses due to parasites and that sort of thing. I would guess that there's a couple 100,000 in secondary Takarati, from what I saw when traveling around.
Go ahead.
Is it close to Accra?
It's not close to Accra. It's about a 4 or 5 hour trip by car from Accra. Now, we did spend some time in Accra, and we went to the Cultural Arts Museum and so forth. And Accra is a very different environment. Accra is a sophisticated city in many ways, but this area is probably like it was hundreds of years ago in terms of the style of living, the foods that are eaten, the occupations that people have. I think it's not changed much at all. Even the way they dress. For example, all the women, no matter what the temperature, have long dresses on and lots of wrapping and hats and so forth. And we were told that if we were to go out in public, do not wear shorts, because only prostitutes wear shorts. Of course, you know, all the students went out the first day in their jogging shorts, and oh no, you're going to wonder why we're there.
Okay, I have a question or a comment. It may be a while before Dr. Groer and I can get our act together regarding food irradiation. But you mentioned you're going back in March.
Mm-hmm.
Is there something that we can do to help you in preparation, or to help you in going back in March?
Well, I'm sure I'll see the Minister of Health for the region, and he has many links to the whole healthcare system in Ghana. So if you had anything that I could bring him, any kind of prospectus or concept paper or anything like that, I'm sure he'd
we can provide that. I had something more material in mind, like money or supplies. Or what do you need? We
need medicines. We have a fund at the college for the Ghana Health Mission, and that money goes to support patients that we see who clearly need to be hospitalized or need much more than we can care for them. They need surgery. We had a man. He came in. I'll just give you the scenario. He came. He says, "My leg's been bothering me, so I've wrapped it up for a couple of months." Well, we unwrapped his leg, and his foot was gone. You know, he had leprosy. It's just unbelievable things like that. Or terrible infections that have been festering for months and months and months because they have no access to care. And, 2 weeks of IV antibiotics would cure them. So we have a fund for those people, to help those people.
Okay.
And donations, sunglasses, or old prescription glasses, give them to Peter, he'll bring them to me. I'm packing up bags of those things to bring over there.
What about the fund? If we want to give money to the fund, how do we do that?
You just write a check to UT College of Nursing and put on the bottom Ghana Health Mission.
Okay.
Thank you for asking that.
Have you tried to establish small college nursing over there, just to?
Oh, thank you for asking that. There is a College of Nursing in Accra. The nursing training that's done in the suburbs or the more rural areas is pretty much hospital-based. It's not collegiate, but there is a college in Accra. So our honor society is going to establish a sister honor society, and we would like to bring one of the chief nurses in Ghana over to this country and award her a membership, and we're working on actually bringing her over and trying to do this kind of linking. Because if we could establish a graduate program over there to train people there, it would help the country enormously. So we're thinking about doing that, actually spending some time doing education over there in Ghana. But they're very interested in the web too. They're very interested in computers. They're just dying to get their hands on computers and web technology so that they can get access to education and knowledge that they don't have otherwise. They're very curious. The Ghanaian people are very curious. When 9/11 happened, all the letter writing to all of us stopped. We couldn't figure out why. Well, they were afraid that Knoxville might be near New York and that it would look suspicious. Mr. Laria, who's writing it, says, I didn't write you because I thought it might look suspicious that I was writing you, and I didn't know how close you were to the World Trade Center. So they're hungry for knowledge, they need the web, and they're setting up a computer school in Sekondi. This reverend who's working with us we gave him a bunch of computers, and he's looking for more computers and computer people, technicians, to help him set this up in the community, teach people computer skills.
Do you find that they have any other major social problems regarding women's rights or family? Yeah,
there are a lot. For example, contraception is considered something that a woman can't do, and part of the reason for that is there's such a high infant mortality. When we were there, we'd see the little children. They have these scars on their faces. And some of them had 4 or 5 scars, lines drawn on their faces. And we'd say, well, what's that? That's for every baby that died in my family. And he's proud of it because he lived, and 5 babies before him died. And some of them have marks on both sides of their face. So contraception's a problem. Men don't believe in it, and women do. Women want it, men don't. So that's one of the things. Also, the family structure is very paternalistic in terms of women's rights. Women have limited rights within the social structure, like not really a right to education, which is kind of hard to believe, but at least in these outer communities, that's true. Not true in Accra, not true in the big cities. But the other thing is that social structure is determined in part by the tribes that the families come from in the community. There are 100 different tribes and 100 different languages. So, when you go from one area to another, there are often armed guards, only to keep the peace, we were told. But nevertheless, think twice.
Any other questions or comments? I do notice that we have some new attendees. You may not know that we have refreshments downstairs, and everyone is invited. But before we adjourn for refreshments, let's express our appreciation again to Maureen.
If any of you would be interested in learning a little bit more, I brought a few brochures over. And because our students were getting academic credit for this experience, they had to do papers and presentations. So we had an Evening in Ghana program. You might be interested in what they were doing their presentations on, the health conditions in Ghana. So.
Thank you. Downstairs.
Your teacher. Thank
Yes.
you. Here's your pen.
Yep. Thank you so much.
Oh, you're welcome.
talking about this.
Yes, we met a little bit before, yeah.
So what date are you going?
March 17th on spring
I'll
break.
be back from Nigeria on the 12th.
On the
Do you have
12th of
your
March?
card?
Let's see, did I bring my card? No, I didn't. Bring it over. But I have yours, so I
Okay,
can
yes.
email you.
Yeah, I'll be back in the office on the 12th.
Email here? Yeah.
Yes,
So
yes.
I can email you and then.
Okay. Yeah, my contact is at FAO. Not
Oh, yeah.
yes. So we normally stay in but this story is very interesting about secondary.
Yeah, secondary is very different than a crop.
Yeah, oh, very, very.
Very different, but
Yes.
I can't wait to get back. I love being there. I love doing what we can. And people are so wonderful.
Thank you so much.
And thank you
I'll
for coming.
keep in touch.
Okay, great.
Thanks for suggesting the food irradiation
Okay,
project.
yeah.
Maybe we can do
We
that.
will do it.
Okay.
Yeah, I think that's could be a really good.
Yes.